Hello, my name is Mike Sugimoto, and I'm the paramedic practice leader for Northern BC, and this is your June 2022 BC Emergency Health Services Clinical Practice Update video. It's my privilege today to speak with you from the traditional territories of the Songhees, Esquimalt, and Wasanix peoples. We at BCEHS acknowledge our traditional hosts and honor their welcome and graciousness as we live, learn, and work together. First up this month, a review of last summer's heat dome prompted changes to BCEHS's approach to the management of heat stress injuries. A new guideline is in the process of being finalized and will be released by the middle of June, which will help paramedics and EMRs provide optimal care and safe conveyance for patients with heat stress injuries, and will also be accompanied by new secondary triage tools to help support patients during extreme heat events. Keep an eye on your mailboxes and on BCEHS's social media channels for more information about these changes. We're pleased to announce that a new urgent and primary care center in southeastern Vancouver has begun accepting patients from BCEHS. The center, which is located on Victoria Drive, is open Monday to Saturday from 8 a.m. to 10 p.m. and on Sundays from 9 to 5. Patients can be accepted there up to 1 hour before closing. Please see the BCEHS handbook for more information on urgent and primary care referral pathways, as well as exclusion and inclusion criteria for these facilities. Several batches of naloxone used in our TakeHome Naloxone kits expired at the end of May. The affected lot numbers are on screen right now. Please check your supply of kits to ensure that the naloxone has not expired. You can dispose of any expired naloxone in the usual way, but please don't reorder complete kits to replace the expired medication. Just order the naloxone separately. When you replace the naloxone, remember to remove the expiry date labels on the kits before placing them back into service. This is a good opportunity to remind paramedics and EMRs about the ongoing issues with supply chains and medication availability. Many of our medications have changed in their appearances. Packaging, dosing, and delivery forms may be different from what you're used to seeing. Please ensure that you take the time when checking your equipment at the start of your shift to familiarize yourself with what's available to you and what these new products may look like. Prior to giving any medication, apply the 6 R's of medication administration. You can find additional details on safe medication handling and administration procedures in the BCEHS handbook at the top of the drug monograph section. For our ACP colleagues, the most significant change is the shortage of pre-filled epinephrine syringes. During the shortage, BCEHS has moved to single ampules for the time being. More details of this change were available in the April operations update. For practice reminders, we'd like to highlight the substance abuse assess, see, treat, and refer pathway that went live provincially on June 1st, with the exception of in the North. This pathway provides paramedics with an alternative disposition for patients who've been involved in a drug-related emergency, but who have declined conveyance to hospital, and allows these patients to connect in with the substance use outreach service provided by the regional health authorities. Please review the criteria for this pathway. You can find details in the BCEHS handbook under clinical pathways. Click on A-STAR, substance use referral, for more information. Unfortunately, the rollout for this pathway within Northern Health has been delayed. We hope we'll be able to share more details on when this pathway goes live in the North soon. BCEHS and its staff continue to participate in and conduct research to advance the state of knowledge in out-of-hospital care. Our largest ongoing trial, Frontier, continues to offer educational opportunities for paramedics working in the trial regions, Vancouver Coastal, Fraser West, and Kelowna. If you work in these areas and you're interested in taking the Frontier training, the next sessions will be on July 18th, 20th, 22nd, and 24th. All classes are conducted virtually and run from 1 to 5 in the afternoon. Please email Ron Strait for more information or to sign up. Congratulations to Fraser West Director Jenny Helmer on her latest publication, which explores the strategies used by emergency out-of-hospital healthcare workers in response to violence and aggression from patients and bystanders. We'd also like to offer our congratulations in advance to Interior Medical Director Dr. Anders Ganstall and to Paramedic Practice Leader John Deacon for their upcoming presentation on the Collaborative Heart Attack Management Program as part of the Physician Quality Improvement Cohort Graduation event in Kamloops. BCEHS Clinical and Professional Practice regularly receives email questions from across the province, and we try to answer these in a timely fashion. We like to highlight some of the more common questions that arrive in our mailbox, and this month, we're taking a look at the scope of practice changes, where they're at, and why this is taking so long. BCEHS is in regular communication with all the various stakeholders involved in the scope of practice change. The specific legal scope is still being finalized by the Ministry of Health, so BCEHS's plans for operational scope and educational development remain exactly that, in the planning phase. Once the scope has been finalized, we'll begin work to operationalize these changes based on best practices, evidence, and operational and clinical utility. It's important to remember that these choices may not necessarily reflect the full legal scope of practice, but rather represent our goals and intentions for our patients and staff. We welcome questions, comments, and feedback about clinical programs, professional practice, guidelines, regulations, and other issues. Drop us a note at clinicalpractice@bcehs.ca, and we'll do our best to get back to you within 10 days. Your question may be featured in a future update. Thanks for taking the time to watch the June 2022 Clinical Practice Update video. Our next update should be in the second week of July. In the meantime, please feel free to reach out to us with any questions or comments. Thanks for your commitment to patient care, stay safe, and have a great day wherever you are.